Hello everybody, I'm here in Amsterdam at the International Association for the Study of Pain conference. It's the World Congress on Pain, and I'm here with a colleague from Canada, Dr. Finley. And he is the person that works with the ISP, this organization, and he helped to write the Health for All means pain care for all, which means what, Alan? You're going to explain to us what it means and what is this so important. Mm-hmm. And so I'll stay here so then people can see you there.
Sure.
Yeah.
So the International Association for the Study of Pain, along with the World Federation of Societies of Anesthesiologists and the G4 Alliance, have been advocating over the past year for the World Health Organization through the World Health Assembly to have a resolution advocating for pain to be part of national health plans. Okay. These are the principles that inform that resolution. They're based on several previous resolutions by WHO, or the WHA.
The World Health Organization?
Well, yeah, WHA is the World Health Assembly, which is the annual meeting of countries.
Okay.
And with ICD-11...
The International Classification of Diseases?
Yes, with a new version, pain is now reportable as a condition in its own right, which helps give it validity. Everybody experiences pain under medical care. And the WHO, we feel, should take responsibility to advocate for pain education, adequate resources in terms of personnel, physicians, nurses, physiotherapists, psychologists, social workers, everybody who's involved in pain care, adequate access to medications and other types of treatments, including those physical and psychological treatments. And this can be done, but it's going to take a worldwide effort of national health ministries, health authorities, the WHO, and all of us individual practitioners and clinicians. So that's what we're trying to do.
Yeah, thank you so much, Alan, for doing this. It's so important that people understand that pain is a disease, chronic pain especially, is a disease on its own right. And people need to incorporate this in the healthcare system to treat pain. Thank you so much.
Yeah. Thank you.